Public Health Week Forum, and especially honored that it marks the 30th anniversary of National Public Health Week. It is also the first time since the pandemic that we've gathered in person for this event. And I have to say, it is just wonderful to be together again. This moment, 30 years into a tradition that celebrates the power and promise of public health, calls on us to reflect not only on where we've been, but where we are going. Over the past few years, the field of public health has been tested in ways few of us could have imagined. But we have also witnessed innovation, courage, and community in action. Today is a reminder that public health is not just a discipline, it is a movement driven by science, by excellence in practice, and by the conviction that every person deserves the opportunity to lead a healthy life. I want to thank the incredible staff at the American Public Health Association and my dear friend, Dr. Georges Benjamin, for bringing us together for this extraordinary event. Georges, your leadership and integrity have been a steady beacon through every challenge, and I'm so grateful for your partnership and friendship. Thanks as well to our dedicated team here at the George Washington School of Public Health, especially the staff who have worked behind the scenes to make this event seamless. Your efforts reflect what we value most at this school: collaboration, community, and a deep commitment to public service. As we celebrate 3 decades of National Public Health Week, we recommit ourselves to the values that have always defined this work: prevention, protection, and progress. And we're so fortunate to be joined by leaders today who exemplify these values in action, including my friend and colleague, Professor Emeritus Sarah Rosenbaum, who you will hear from later today about the progress we have made over the last 30 years. But it's now my pleasure to introduce the president of the American Public Health Association, Dr. Deanna Wathington. Dr. Wathington brings more than 25 years of distinguished experience in public health practice, education, and equity-driven research. She has served in leadership roles across academia and government, including as chair of APHA's executive board. Her work has improved health outcomes in countless communities, especially through her focus on maternal and child health and equitable community development. Please join me in welcoming Dr. Deanna Wathington to the podium.
Thank you so much, Dean Goldman. It's wonderful to see you today. On behalf of the American Public Health Association, we are deeply grateful for your generosity in hosting this celebration of the 30th anniversary of National Public Health Week at the Milken Institute School of Public Health. Thank you very much. For those I haven't had the pleasure of meeting, I'm Deanna Wathington, president of APHA. Good afternoon, and welcome to all esteemed colleagues, distinguished guests, dedicated public health advocates, all joining us both in person and online via YouTube. For 3 decades, National Public Health Week has united communities to celebrate the power of prevention, champion policies that promote health, and highlight the essential role public health plays in our lives. Today, as we mark this milestone, we not only reflect on the progress we've made, but also look ahead, exploring the challenges and opportunities that shape our ongoing mission to advance health equity and improve well-being for all. In an era where information spreads rapidly, distinguishing between fact and fiction has become increasingly challenging. The digital landscape, while offering unparalleled access to knowledge, also serves as a conduit for misinformation, posing significant threats to public health. Our first panel, Fact versus Fiction, Combating Health Misinformation in the Digital Age, brings together a distinguished group of experts to address the pressing issue. Please join me in welcoming our esteemed panelists, Dr. Georges Benjamin, Executive Director of the American Public Health Association, whose leadership has been instrumental in advancing public health initiatives nationwide. Dr. Joelle Vervel, social media's medical mythbuster and host of the Dose podcast with the Commonwealth Fund. He is a Forbes 30 Under 30 honoree, a TED Fellow, and a White House recognized change maker. He uses social media to fight health misinformation and champion health equity for millions worldwide. And I have a personal goal to become as good at social media as he is, but I don't think I'm good. And then Dr. Julia Daisy Frostino. She's director of the Public Interest Communication Research Laboratory, whose research focuses on effective communication strategies and, effective communication strategies to promote public health. And we are very pleased to have all of them here today. Thank you very much. So together, they will explore innovative strategies to counteract health misinformation, reflect on significant public health gains of the past 30 years, and discuss pathways for continued progress. So, Dr. Benjamin, now we'll turn it over to you.
Well, good afternoon, everyone. I want to acknowledge Dean Goldman. As many of you know that Dean is retiring soon, and which means that I can put her to work full-time doing some other stuff for APHA. I'm excited about that. And I just want to acknowledge my president, Dr. Waltington, and thank her very much for being here today. You know, this is the 30 years of the American Public Health Association, which designate the 30 years since President Clinton formally designated this as the week. And I think that's an important point. Like many things, of course, National Public Health Week occurred long before in many ways. It actually goes back to the old Negro Health Week. And then a former APHA president, Cass Evans, actually initiated the first formal National Public Health Week when he was the health officer in Los Angeles many, many years ago. And then it kind of rumbled along with lots of groups trying to play the national role, and then APHA, of course, had the honor to pick it up as the national organizer. And it's a week of celebration that we try to do. And of course, we're now operating in a very different operating environment than we actually started out when we planned this week, but nonetheless, it's a different operating environment. And one of the challenges this panel, I hope we'll talk a little bit about, is this whole issue of making sure that facts are facts and information gets to the people so they can make informed, data-driven decisions. It's going to be very important. As you know, trust is gained by drops and lost by gallons. And I think that's the real challenge we have, particularly in a world where information moves at the speed of sound. So with that, I'll turn it over to my colleague and hear what he has to say. Dr. Joel.
Absolutely. Hey, everyone. It's a pleasure to be here. My name is Dr. Joel Burvell, newly minted doctor, so I'm still getting used to saying that. But I'm so honored to be here. Thank you so much to the APHA for having me. For me, when I think about the current climate that we're in a time that, as was mentioned by Dr. B, is unprecedented. Even as a medical student coming into the COVID pandemic, during my first year, that's when the COVID pandemic hit. I immediately started seeing misinformation online, and it made me want to better understand how can I, as a future physician at the time, not just be someone who regurgitates facts, but actually teaches individuals to be able to spot fact from fiction. And I think today it's become even more difficult when we have people at the highest levels of government that are unfortunately spreading fiction when we know the facts. And so it's about how do we make sure that evidence-based medicine, evidence-based science comes to the forefront of these conversations. And for me, it's by using social media, which can seem like a weird place to use it, especially as we mentioned earlier, when fact unfortunately is not spread as quickly as fiction does, especially on social media. Partly because of just the way social media companies are run, it's the more engagement, the more clicks, the more shares that you get. Information that gets most of those clicks and shares are things that are sensationalist, that don't always make sense. And so I hope during this panel today what we'll talk about is how do we actually make sure that we're pushing forward information that's correct so that we can create a safer workforce overall. And I think by rooting it in stories, and I'll keep coming back to this, by rooting it in stories, by talking about individuals, by talking about the things that are happening today and how it's impacting, how rhetoric can impact people's opinions and change that, and realizing that it doesn't always lead to, when we're not able to put out accurate information, it leads to great harm. The more we're able to show that, I think the better we're able to get fact out there. So I'm excited to just kind of jump into the questions.
Well, hi, everyone. I'm Julia Frostino. I hail from West Virginia University, where I run the Public Interest Communication Research Lab. And that kind of unites both of our other panelists here today. We just heard a moment ago, trust is lost in a drop. Gained in a drop and lost in a volume, and that's the truth. And then misinformation circulating online and the connection and the engagement. What ties all of this together to me as a risk and crisis communication scientist is relationship building and communication. And that's what my passion is. And just as we've heard that we need to get evidence-based information out and what you all dedicate your careers to doing, there's evidence-based communication. So that's what I want to advocate here today for the inclusion of crisis communication scientists in everything that we do, and the essential role of community in building trust, maintaining trust, and keeping our public health infrastructure one that can serve people on sunny days just as much as rainy days. So I'm excited to be here with you all today, and honored to be here on this important occasion with my esteemed colleagues. So I'll both participate and moderate, and in doing so, let me just go ahead and get the questions rolling. So before we head into the big question about bridging the gap, I would love to turn it over to Dr. Joelle for a second, because I don't know that we've defined our terms. And, as the communication scientist in the room and the professor, I must say that we need definitions up front. So Dr. Joelle, do you want to talk to us about how you think about misinformation and disinformation?
Yeah, and I can start, and if there's anything I missed, please feel free to add. So for me, misinformation is about information that's not evidence-based, that's not agreed upon by scientific community, that's spread online, and that is incorrect. And it continues to spread because maybe it falls into some type of bucket that feels like it could be right, or plays into conspiracy theories or just different beliefs that are out there. But it's accidental. It doesn't always have to be, it's not someone that purposely doing it. Disinformation, on the other hand, is purposeful information that's spread with the intention of misleading a population, an individual, a group, in order to make them believe something that is not true. And so when we see this, it could be someone that's trying to, like a snake oil salesman, for example, someone trying to put out information out there so that they can gain from kind of chaos within an environment.
Yeah, I would agree. It's all about intent, and at the end of the day, and the other thing is, of course, there's always nuances to that, and some of the nuances, of course, are when people give partial facts as an attempt to mislead. So it becomes disinformation because they're giving something that is truthful, but they're doing it in a way where you know how people are going to hear it, and you're trying to drive them to your point of view with an agenda.
Agree. And heading back to misinformation for a second, I mean, Dr. Joelle just mentioned it's something that doesn't necessarily have to be intentional, and that happens all the time. I think of, in addition to being a crisis communicator, I'm also a mom. She is the love of my life, the light of the world, the hope of everything that exists, my 7-year-old. And the other day she said to me, "Why can't I swallow my bubble gum?" And I said, "Because it stays in your belly for 7 years." She said, "But does it?" And I said, "Actually, good question. We should probably fact check that." So misinformation unintentionally spread by her scientist mother to her. But it happens to all of us, and I think well-intended, but we need to meet people where they are with the information they're ready to hear and the ways they're ready to hear it from the sources they trust to hear it and discuss it with. And that's the entire role of communication. So bridging the gap here, let's get to that. Traditional public health institutions often struggle to compete with the speed and engagement of social media content. What strategies can public health professionals adopt to ensure accurate, science-based health messaging reaches the public effectively? And how can digital influencers support this effort without compromising credibility? So I think I will turn it over to Dr. Joelle first, since he is the social media extraordinaire in the room.
Thank you. Well, I'll start by talking about, I think, places that are doing it right, and then use the kind of lessons that we learn from them to understand what are they doing actually to get information out there in a really interesting way. So I'll use one that's non-medical first, and that's Wendy's. How many people have seen Wendy's account online on social media? Okay, how many people, if I told you like to define the voice, you'd be able to do that right now? And be like, oh, I know what Wendy sounds like online. Okay, so I'm seeing some people. So for those who haven't seen with a Wendy's profile, it's very snarky. It's very like, it's like a person that kind of like comes at you and is just not totally on your side, but they found within their brand a voice. And I think what brands and public health institutions often don't do is find a voice for how they want to communicate their information. You have to root it in something that feels real and human in order for someone to want to believe it. I think a public health institution that does that well is Johns Hopkins' Instagram page, where they do a really good job of diving into trends and feeling like as if it's a person that you're talking to, not an institution, but an individual that is sharing this information that we got from your brother, from your sister, from your mom, from your dad. And so that's really what I try and do every single day that I'm online trying to spread accurate information. I've actually had people come up to me and say, I feel like you're like my son, my nephew. And I think part of the reason why is I think about my social media as the information I wish that my parents, who are both from Ghana, West Africa, and didn't grow up in this country, or my siblings, like my brother, who's not in medicals, not in the medical field, and thought that I'm going to out him right now, thought that we had two stomachs. I don't know where he got that from. He's a super smart guy. He went to Harvard Business School, but we were talking one day, and I'm like, that's not how our body works. But I think it's all about how do we try and make this as individual as possible and bring this to a way where people feel as if it's an individual voice speaking to us. There's all the time people are online. There's all these trends right now online. That means things that people will see online and want to kind of participate in. It can be a trend like a get ready with me, where people are putting on makeup. And some of the best content I've seen from other influencers, digital influencers, is like a get ready with me, and I'm gonna do my makeup as we talk about what public health means to me, or the 5 different ways that individuals in public health have changed my life for the better, but maybe you never knew about it. Or maybe even like a day in the life, where you walk around and you show what it looks like to have an area that says no smoking, and talk about the smoking cessation and what it took to get there, talking about someone taking PrEP or medications like that, and talking about the HIV/AIDS epidemic and the public health conversations that had to happen to get people to believe specific things. Rooting it within everyday experiences, I think, is the best way on social media to spread accurate information.
Dr. B, anything to add?
I just add that one of the challenges we've always had in public health is that we don't build our infrastructure to deliver these services quickly enough. Government is always a laggard when it comes to engaging new technologies. And it shows. The fact that we are always chasing other public health rumors is because even when we have young, energetic, practiced individuals, particularly our new students, who are very comfortable and competent to do social media, the rules don't often allow them to do that. And so I think one of the things we've got to do, both on the governmental side and on the non-governmental public health side, is very quickly figure out what those policies are and procedures, put those in place, because the concern always was that somebody in government would say the wrong thing and offend somebody and undermine some political process. And that's always been the concern. But the truth of the matter is the social media companies do this all the time, and they actually know how to do it, and we can learn a lot from them.
Yeah, one other thing I'll add, another place that's doing it well, the World Health Organization has been starting to lean a lot more into digital influencers. So there's actually a group called Operation FIDES, Operation Truth. It's a collection of physicians, scientists, researchers, nurses, PAs, name it, that are online already spreading accurate information. And now what they do is they create a newsletter, and once a week they send it out with the accurate information that we could be talking about. So the fact that for today is World Health Day, wanting to actually send out information that we could talk about specific things, whether it's tuberculosis and what that means and changes in discussing that, or what USAID was doing in different countries and how we can be talking about that online. I think more services like that, which are connecting people to the evidence-based information, is really important too, because sometimes it can be hard to find that information, especially in a landscape like today where people are unsure where to look and it's getting harder to know.
Absolutely. I think that this is all getting at, back to what Dr. B was just saying, infrastructure. It's the infrastructure we need. And part of that is communities. It's the engaging partnerships at all times with people in online communities, but also right on the ground. I mean, I started my career in flooding communication, and all disasters are local, and that's the truth. You know, the people on the ground, that's where the trusted relationships happen. It can bridge a lot of divides, and building those communities, even when there isn't maybe the support up top or the funding to do it, there are people in every community who want to partner with their local health department, who represent the local chapter of the American Academy of Pediatrics, or the Medical Association for the state, who are engaged in the schools, or who is a data scientist at the local university. All of these people coming together from where I sit is where we move our relationships forward. We saw it in the pandemic. I had the honor of leading the Joint Information Center within the state of West Virginia during the pandemic for evidence-based communication, and uniting all of these partners at the table, giving them a voice and a seat, listening, truly listening, enabled us to sing from the same hymnal, as my dad would say. And part of the reason that misinformation spreads so fast and easily is that it hits people's values, and it's the same message over and over. You all are probably familiar with the illusory truth effect. You hear something once, even if it is counter to what you thought initially, and you kind of put it in your back burner for a second. I'll think about that later. You hear it a second time, and you're statistically significantly more likely to believe it, even if you knew on the onset it might have been false. When you hear something over and over again, you're likely to think it's true. That's a problem from a misinformation standpoint, but it's an opportunity for us from a truth standpoint. So uniting partners, for me, I think, is the way to go. And then you can amplify the effectiveness by engaging a communication scientist to help you with even down to the word choice, which we can talk about in a moment. But so we've highlighted a couple of times here the role of trust, and we know that studies are showing declining trust in public health institutions, while social media influencers often build strong personal trust with their audiences. So what role does trust play in combating misinformation, and how can public health leaders and influencers collaborate to restore confidence in science-based health guidance? And Dr. B, you talked to us about how trust is gained. Would you like to speak a little more about trust?
Yeah, trust is everything. And, you know, as you know, I spent the first half of my career practicing emergency medicine. And, you know, it was always fascinating that we could gain trust in medicine because it's really a 15-minute encounter. Sometimes it's a 15-minute encounter over many years. But the real challenge is, how do you maintain that trust? Part of it is because of the white coat. They know you went to school, they know you're there to help them, and so you walk in with some degree of acceptability and trust by going in the door. The challenge in public health is we're the faceless bureaucrats that nobody knows. And, you know, during COVID, we had the faceless bureaucrat nobody knows now telling people, here's the health advice that we want to give you today. And of course, it changed over time, which also creates a real challenge around trust on this. And then we told people they had to wear a mask and they had to take this shot and they had to stay home. And we totally disrupted their lives. And the truth of the matter is we had not built that trusted relationship. And in most cases, didn't have the white coat. I mean, we did not come to us seeking our health and our help to try to help them. We had to build that over time. So one of the challenges I think we're going to have to do in public health is do a better job of telling our own story. That means going into the community, engaging people before we have to engage them for health issues. Make sure they know you. In this town, I had the challenges of dealing with HIV/AIDS in the early days of the HIV/AIDS epidemic. And it wasn't until we in public health got into those communities, talked to people that were impacted by HIV/AIDS, showed them that we cared, showed them that they could trust us, that we began to get those kinds of trusting relationships. I think that's one of the things we absolutely, certainly have to do to build that trust. And it starts now. It starts now. And the other thing is empowering trusted messengers, because, you know, even in a clinical practice, quite frankly, quite often the nurse in your practice, a nurse practitioner or the PA is much more trusted than the doctor. At least they're certainly reinforcing. And in public health, we have community health workers, we have influencers that we can engage in doing COVID. You know, we use some of the most trusted people in town, beauticians and barbers. And also Mrs. Jones down the street. Everybody knows Mrs. Jones. There's also Mr. Jones. And they're the community person who knows everything about everybody. And they're probably the most powerful political figure in town. And engaging them so that they can actually be part of rumor control can be very powerful in public health practice.
Yeah, I think trust is paramount to being able to actually combat misinformation. And part of the reason why is you need trust in order to get data. If a community doesn't trust you, you can't go into that community, understand their needs on the ground, and then use that to best make informed decisions. For me, I think part of the way you build trust is by also talking about when trust has been lost. I think for a lot of communities of color, we have a history in the medical or even the public health field where we haven't felt as if we've been included in the correct way. And you can point to studies like the Tuskegee syphilis experiment or even what's happened when it comes to eugenics. And within communities of color in the United States, those are ongoing conversations. And I feel like on my platform, I've built trust by actually talking about those and talking about what we've learned and the changes that we've made in medicine, in public health, because of those atrocious things that have happened. And so I think in all aspects of building trust, it comes from understanding a legacy of mistrust and where that comes from, and acknowledging that it makes sense that we don't trust these institutions because, as you noted, they are faceless bureaucrats. And it's figuring out how do we make sure we bring it down to the human level through Mr. Jones and Mrs. Jones down the street, through barbershops, and engaging them in really interesting, on-the-ground kind of panels where or not panels, but just conversations where your barber is now telling you about, hey, did you know about pseudofollicularis barberi, right, or whatever, or talking about different things that you never thought you'd be discussing, maybe talking about blood pressure or diabetes with different partners, because as you were mentioning, it comes from finding different touchstones, and the more touchstones you have that aren't connected, the better you're able to remember a piece of information and make sure you use that. So I think trust is paramount to everything. Trust is paramount to data. Trust is paramount to understanding how we build communities that we get people to believe us, but it comes from really taking it down to an individual level.
Absolutely. Communities are essential, and communicating with them, the only way we can do it effectively is with them, where they define their problems based on their lived experience with us, and we co-create solutions. And that can be something as big as a new innovation. And we can keep it on the pandemic topic. You know, West Virginia created the COVID-19 vaccination due date calculator as a result of talking to people and finding out that they were so confused that they were becoming apathetic on when to get a shot, what kind of shot to get, how to get it, where to get it. And we needed to make that easier for them. That can be a big innovation like that. Or it can be down to word choice. So let me give you a little thought experiment here. If I say to you, mass blank, fill in the blank. I have a feeling what you'll say because you're public health people, but mass blank, fill in the blank. Right, which is what you all have, vaccination, which is a common public health term bandied about easily like it's water dripping off a slide, right? Mass blank, I say this to the general public. What answers do you think I get? Shooting. Media, sure, which is also a bad term apparently these days. Hysteria, genocide, graves. If I even ask them, tell me something good that comes off of after mass, they look up at the ceiling, they wiggle their toes, and they can't get to it. Our cognitive associations, whether we realize it or not, are tied to words. You know, you act a little different when your mom calls than when your boss calls, than when your child calls, maybe, you know. We pull up a file of associations in our mind, whether we realize it or not. Something as simple as calling something a mass vaccination clinic in West Virginia. We got a ping in that in qualitative research, did a quick messaging experiment, and found that participants were statistically significantly less likely to intend to go to a mass vaccination event than a community vaccination clinic. So we were able to mobilize our community-based coalitions and all of the groups that we'd already had at the table making these decisions together, so that we were all calling them community vaccination clinics. little things like that or big things, but we can't overlook the communication piece or the dissemination piece, which can only be done through relationships and partnerships. Before we head to questions, I just want to see from each of you if you have an idea about lessons from the past, solutions for the future. So reflecting on the major public health victories for the past 30 years, what are the most effective models for combating misinformation, and how can insights from past public health campaigns inform a new era of digital-first public health communication?
Yeah, I think the most important thing we can do is when you go in these communities, do more listening than talking. Go into the communities and say, I'm here to listen, and do a listening tour, truly do a listening tour. And then come back once you've done your listening tour to engage the community in whatever you wanted to engage them in.
Yeah, I totally agree with that. I think also we haven't really talked about pre-bunking very much, and so the idea of like giving people information before you even get to a situation where there's a lot of misinformation. So right now, the big thing that people are talking about is vaccinations, right? Because of RFK's nomination, and there's a lot of sentiment online where that's a huge conversation that I see on social media. But my goal is always to think, how do I give people information before misinformation is rising so that they can accurately discern what is true and what is not true. So it's all about making sure you give people the tools to spot misinformation ahead of time. And one of the things I always ask is, how many people in this room are on social media? Just raise your hand. Keep your hand up if you were ever taught how to use social media. Taught how to use social media.
There was no such thing when I was in school.
So it's either there's no such thing, or even today, if I ask this in the elementary school classroom, the hands all still go down. No one's ever taught how to spot misinformation, how to think about the ways people are using education online, to think about different stakeholders. I think those are all things we should be teaching in order to have a more informed public that can make judgments for themselves. The last thing I'll say is there's my favorite book called Made to Stick. It's by Chip and Dan Heath. It's about how do you make ideas sticky. I think it's something that we could take in public health. They have this acronym SUCCESS, which stands for simple, unexpected, concrete, credible, emotional, and you wrap it all up in a story. And I think as soon as I started thinking about everything I say that I want someone to remember with that framework, it helps me better make sure that my audience was hearing what I wanted to say and picking up accurate information easier than they're picking up misinformation. But it takes, you have to come from making it simple enough, from making it unexpected to what they believed before, concretizing it, not making it abstract, making sure it's rooted in credible information that's evidence-based, making it emotional so they understand why it appeals to them, and then add a story, because at the core of everything that it means to be human, we're all storytellers, whether it's with our family members, whether it's with our friends, and that's what it means to really get information across.
Absolutely. We're biologically wired for connection, which Dr. Joel and Dr. B would know way better than I as the communication scientist, but I can tell you that the storytelling is what connects us and builds those relationships. So hopefully we'll be able to talk a little bit more about pre-bunking and debunking and post-bunking and some of this myth busting through this question and answer session. But in the interest of time, I want to make sure that your voices are able to be heard and we can have a conversation here. So would like to send it to the floor first for questions. I think we have a microphone. Okay. On its way, the fabulous Ursula.
Hi, everyone. My name is Vina, and I just loved all the perspectives that you shared. Combating misinformation is really important to me. I work with high school students. And one thing I'm really interested in hearing from your perspective, how it's affecting your work. We know that platforms are taking away a lot of the safeguards around verified information or putting down like, hey, this information may or may not be true. And so removing those features, to your point, Joelle, makes it much harder to figure out what is and isn't true. So how has that affected your work or changed the way you're approaching communicating health information?
Yeah, I can speak about this from thinking about like the platform side. So I thankfully been able to work a lot with TikTok and Meta on thinking about how do we make the platform more safer and better, basically have more accurate information. So literally 2 weeks ago, I was giving a talk at TikTok and I was speaking with their head of trust and safety about how I think one of the features that they need to add on there is if someone is a licensed professional, that should be a badge that's actually on there, so you know that it's actually trusted information. Right now we have like a little star there, but that's basically it. Things that they did well during the COVID pandemic, linking out to accurate information. They saw an uptick in people understanding where to actually go. So if you posted about COVID or vaccinations, there would actually be a little banner that would appear. You could click on it. It would send you to an evidence-based source that we knew was trusted. I think those types of things are what we need to be doing. I also spoke to them about saying, how do we actually change, this is something that's not going to happen, but what if we change the algorithm? So instead of just rewarding people for clicks and likes and shares, you rewarded them based on the accuracy of your information. That would be something, there's no social media platform that does that right now. But if there was, that'd be the most interesting social media platform to me, where I know that it's up-ranking. And in a way, I think Reddit gets the closest to it because you have to up-rank based on what people believe, but no other platform really does that right now. So to your point, yes, we need more ways to make sure that we're incentivizing for accurate information. It doesn't exist right now. I think there are a lot of ways to actually be doing it, but that just aren't in the zeitgeist. So the more that we talk about it, the more we put these ideas out there, I think the more that the platforms will realize that people want this information.
So piggybacking off of that, we have a question from online, and then maybe we'll take another from the audience on the other side thereafter. So what skills and competencies should be integrated into public health education to prepare the next generation of professionals for combating misinformation and promoting media literacy?
Let me start with the most important one is a behavior change. And we all love a good rumor. I absolutely love a good rumor. But the first thing I think with the behavior change is when you see something, don't send it. You know, it's kind of like when you're mad at someone, you write the letter, don't send it. Even though it might be juicy, might be something you think is true, the challenge we have is that you need to validate it first. And in the old days when we had snail mail, some of you may remember that, piece of paper, you write something on it, you put it on a stamp and you drop it in these little boxes around town, and they eventually would get there. The challenge is that, you know, again, when you send something, there are mechanisms to retrieve it, but they don't really work. And so once it's gone, it's gone. And so more times than not, I've seen creditable people send uncreditable information that just didn't make any sense, but it was juicy, and so they sent it. And so I think the first thing we need to do is self-police. Second thing I think, of course, is to get the training. I mean, to learn how, what words work better and understand that this is a big country and people hear things differently. We have visual, we have non-visual learners. We have people that, again, have materials that are, and understandings of things that are very different educational levels. But I think the thing that concerns me the most is the fact that there are the disinformation folks are way ahead of us because that's what they do. That's what they do. And, you know, when something bad happens, they are hot on it, putting out information. And the best way to get good information, the best way to address bad information is with loads of good information. But we're chasing them. They're way ahead of us because that is what they do.
Yeah, one thing I'll say is I think we need to create ecosystems of accurate information. So right now, when you're saying that people that are putting out disinformation are ahead of us, part of the reason why is because they have ecosystems within it. So there's podcast networks. So let's say you start with a rumor on social media, then maybe you hear it on your podcast afterwards, and then you hear it on the news suddenly, and then you start hearing it from your neighbor, right? And those are like the ecosystems that exist to then get all those points that you were talking about before of having these different places, but they're purposefully done. They're individuals that are actually putting disinformation out there for some specific reason, whether it's political, whether it's monetary, economic, financial, whatever it be, there are reasons why that's happening. And so I think recognizing how those ecosystems operate is one thing we need to learn how to do in public health, and then figuring out how do you disrupt that ecosystem. What is the piece of information that is missing that will allow someone to step back, to actually want to go and say, let me look this up and actually check if bubblegum actually does stay inside the stomach for a long time, and then being able to actually disrupt that moment. And for you, I would say it's because you're a scientist and thinking about it, and your daughter who is hearing this for the first time ask that question. But what is it that makes us actually step into that and say, I'm going to look this up and actually check if it's true and find other sources that are not around my immediate echo chamber to make sure I'm not missing something?
And modeling it, I get this question all the time. How do I engage? It seems too big. I don't want to feed the trolls, and nobody should feed the trolls for sure. However, to the extent that you can model the behavior that we want to see and amplify accurate sources and accurate information, that can prevent other people from sharing the misinformation. So it's not so much to respond and have a conversation with a troll, however you want to define that online, but helping the wide variety of people who are lurkers on social media, who are reading but not responding, who are not engaging, but who might share it in their online and offline networks. And you can disrupt the spread of misinformation by sharing accurate information and modeling how you would do that. So here's another piece. Instead, we're so inclined to repeat a rumor or a myth when we hear it, right? Like, even if I just say you have a human inclination, if I say to you, you're a liar, what do you want to say back to me? I'm not a liar. That's what you want to say, right? But if you're not a liar, what are you? A truth teller. I've told you the truth. See, we're not creating the illusory truth fallacy over and over. We're not repeating the myth, but we're still addressing it and debunking it. We see this, for example, HPV vaccination. I've done a lot of work in that in the state, and you'll get parents who will say, I'm worried about fertility. I'm not going to get my kid this vaccine because I'm worried about them being able to have kids when they grow up or something like that. Instead of saying, HPV vaccines don't cause fertility. It's HPV vaccines are safe for people who want to become pregnant now or in the future. In fact, HPV immunization can prevent cancers that affect fertility. See how we flipped it? Just modeling that behavior and then citing a source after it can disrupt the flow of misinformation without repeating and solidifying in people's minds the inaccurate information. So let's take one more question from the audience, and then.
Hi, my name is Dr. Adriana Campos. Thank you all for speaking. Still on the topic of mistrust or like misinformation, disinformation, I want to talk a little bit more on the mistrust of the lay folks to the scientific community, specifically to federal agencies and the scientific workforce. I was one of the scientists affected by everything that's going on. So for me, it's really personal, and it's really important to do this advocacy work and to speak out to your neighbors or to whoever it may be, whether or not you think that they're on your side or not. But I think it's really important when it comes to misinformation and disinformation is to kind of understand and humanize everything to those individuals. And I think I would love to know your perspectives or your suggestions on doing this as scientists on your day-to-day. What can you do as a public health professional other than, maybe talk to your neighbors? But there's a lot of individuals from the advocacy work that I've been doing that are afraid. Right. So they are afraid because of not only the misinformation and disinformation about the work that we did or we do or the agencies do, but about the trolls and about, doxing and about anything else. Right. And it's a mental toll to make these videos, as you know, right? It's a toll to comment back or to edit a video on these things or to do a day in the life. It's not easy work being an influencer or being on social media. So I would love to know your perspectives on how affected public health professionals can start working and building coalitions to combat the misinformation, disinformation about the work that they do and the agency work specifically, especially with everything that's been going on with the NIH and FDA and all that. And I would love to know what resources an organization like the APHA or other organizations could offer or could help with those affected public health professionals.
Well, let me start by just saying that, first of all, we probably ought to toss the word public health in the trash can. because nobody knows what it means. We can't even tell our family members what we do, right? But only because we don't tell them what we do, you know. Yes, we are the people that make sure the air is safe to breathe, the water is safe to drink, and the food's safe to eat. People understand what that is, and then you can explain further your role in doing that. So I think we need to be more focused about exactly what we do in terms of our skill set. Second thing is the folks that are actively trying to take away our government. Everyone says, okay, the government's gotten too big. Let's bring the government size down. That's hard to argue against. There's always something that can be improved on. That's also very difficult to do. So you're right. You have to humanize it. You have to say, these are people who have lost their jobs. They've lost their jobs acutely. And when I'm on talking to folks that are very supportive of the federal efforts that are going on right now, I asked them, what would you do today if you suddenly went into your organization and they simply gave you a pink slip? Most folks think that when you lose a federal job, you actually get severance pay like you do in the private sector. They don't understand that when you lose your job, you've lost your job. You get that check 2 weeks from now, and that's it. So I think the challenge that we have is that they really don't understand the workforce because we've not humanized them in many ways. Now, APHA has actually stood up a landing page on our website for people that have lost their jobs. I encourage people to go there if you're in that situation. And we decided that the theory of change for us is, one, make them follow the law. So we've been involved in many lawsuits to make them follow the law because many of the actions that have been done, in fact, almost all of the actions have been done illegally. Secondly, we have said that we need to recognize that this flood the zone strategy is great for football and basketball, but as an ER doc, I know how to triage. And so we are focused on the things that are most important: funding, personnel, again, making them follow the law. And then the third thing that we do is raise visibility, and that is making sure that the public knows who's responsible. And the days in which we were very tactful about saying who is responsible, we're not doing it anymore. We're giving names, taking names, telling people who was actually responsible, and because helping people understand who's responsible allows them to go in and talk to their elected leaders and say, not only are you responsible, but you have the ability to do something about it. So also helping them understand what they can do. And anyone who doesn't think that sending a letter in, phoning your elected officials, and giving them their views, regardless of what your views are, doesn't impact, you don't understand the way this government works. And the truth of the matter is, they count every phone call they get. They count the letters, even the form letters they get, and it forces them to respond. So I think, and then finally, the most important thing two things. The most important thing I think that's important for us to understand is they work for us. We write their checks. They may not understand that, but we do. And then finally, people can only be as powerful as you give them the power. Don't give them your power. You give them your power when you run from them when you're afraid. They're going to do what they're going to do anyway. So that's been our position, at least at APHA, is we've been around for 150 years. We're not going anywhere, despite what they think.
Absolutely. APHA.org for more information. And so in the interest of time, 30 seconds, do you want to?
Yeah. I'll say yes, being an influencer is hard, but there's other ways to get that information out there. It's talking, and it's everything you just said. It's talking to individual people, making sure your story is heard, not about just what you do, but why you did it. I think too many people think federal governments are for some reason millionaires. I think everyone in this room knows that's not true. But if you were to listen to the media on other sides, you would believe that. And so it's telling about what you do and why you do it, explaining your why, and then finding other mediums to do it. It doesn't have to be through a video. It can be an op-ed. It can be talking up with a journalist. It can be speaking with a friend, you know. It can be teaching a class about the work that you were doing. It can be going into an elementary school and saying, here's why I was a federal worker. There's so many different ways to start spreading accurate information about why you do the work you do and really humanizing it. And so that's what I would say is find other methods of connecting with people about the work that you were doing and why it mattered to you.
And I guess we'll close by saying thank you for everything that you've done. What you do matters, and all of you who are affected by that, what you do matters, and all of us working together is going to be the solution. So these two famous colleagues of mine, you can reach them easily online, and as for me, Country Roads will leave you home, so come on over to West Virginia and you'll find me there. Thank you so much for your time, and we'll hand it over to the next panelist.
Wonderful. Thank you so much to our esteemed panelists for your insightful discussion on combating health misinformation. Actually, your expertise and dedication are invaluable as we all try to navigate the complexities of the digital age to ensure that accurate science-based information prevails in the name of public health. As we transition to our second panel, we shift our focus to the future of public health, building upon the lessons and successes of the past 3 decades. Reviewing the achievements of the past 30 years is truly exciting. Public health has made remarkable strides, from reducing infectious diseases to advancing health equity. Yet, as we look ahead, new challenges such as climate change, the rapid spread of misinformation, and declining trust in health institutions demand innovative solutions. We remain the invisible shield, even despite all of the publicity that's ongoing. Our second panel, Past is Prologue, using the gains and lessons of the last 30 years to improve health in the next 30 years, features distinguished experts to explore evidence-based approaches for tackling the health challenges of tomorrow. The panelists will discuss cutting-edge strategies, lessons learned, and the transformative actions needed to build a healthier, more resilient future. The discussion will also highlight the critical skills and abilities that the rising generation of health professionals must develop to lead effectively in an evolving public health landscape. So we kind of already started that conversation, and we are going to continue. So please help me welcome Sarah Rosenbaum, Professor Emerita of Health Law and Policy here at the Milken Institute, and just a fabulous human being whose work has profoundly influenced health policy and access to care. Dr. Brian Castrucci, President and Chief Executive Officer of the de Beaumont Foundation, known for his leadership in creating practical solutions to improve public health. And Veena Tamalsevan, our very own Master of Science in Public Health. She's our very own immediate past chair of the APHA Student Assembly, representing the next generation of public health leaders committed to advancing health equity and public health. Together, they will discuss how evidence-based actions, strategic partnerships, and emerging technologies can enhance public health outcomes in the coming decades. Sarah, let's begin with you.
Am I on? Yes, you can hear me. Well, I am a lawyer by training, and so probably it's inevitable that I tend to think about law when I think about the great achievements of the past 30 years. But there are two achievements that, to me, transcend the law. They are the culmination of multiple generations worth of work. And they are probably the two, from my perspective, the two greatest statements of social solidarity we have mustered in the past 30 years. The first one is the insurance reforms in the Affordable Care Act. Insurance, of course, is the ultimate statement of social solidarity. We all agree to share the risks of illness with those with whom we share society. And while the Affordable Care Act, of course, was not perfect, it achieved an enormous shift in thinking. We're seeing that today. I'm sure we'll talk about it. An enormous shift in thinking about the importance of, the benefit of, the value of, and the absolute need to defend insurance coverage for Americans. So that's number one. And the other, also part of the same law that gave us the insurance reforms, is what is known affectionately as Section 1557 of the Affordable Care Act. This is the monumental civil rights statute that is part of the Affordable Care Act. It is the culmination of decades and decades of civil rights battles that preceded it, ranging from the very first monumental civil rights law, Title VI of the 1964 Civil Rights Act, and going through, of course, the Americans with Disabilities Act. It is 1557 that for the first time in American society established civil rights protections based on sex and gender, and most importantly, spread its protections over all healthcare entities, any part of which receive federal financing, which of course is the entire American healthcare system. So as somebody who has spent a lot of time thinking about social solidarity as our greatest aspiration, I consider these two reforms to be the sort of the ultimate acts of the past 30 years.
Good afternoon, everyone. It's a lot of fun to be here today. I find it ironic that we are talking about the progress that public health has made given where we are, given the active work to undo what we did. You know, when you think about public health, steel may have built our skylines, but public health built our country. It was something that if we did not have public health, we would not have been able to industrialize. Public health didn't just make America, it made the American dream happen. How often have you ever heard that? How often when our kids say, what started the Industrial Revolution? I think it was Eli Whitney and the cotton gin. You know, my daughter said, no, it's public health. Now, she failed that class, but I appreciated her effort in saying what it is that public health does. I mean, we eradicated diseases. We've wiped out smallpox. We've ended disease. We used to invest in science and fund the people who delivered this for us. We were on the path to being the healthiest nation, and now we're not. And that's what concerns me, is all the progress that we have achieved to this point, only to be where we are now. We advance conspiracy theorists over people who are scientists. We have experts silenced and public health workers being demonized for doing their jobs. And our elected leaders brag about their ignorance. We have to understand where we failed as public health. We did have great progress. We also had great failure. We are in the situation we're in today somewhat because of our own complicit behavior and not figuring out ways to work with people across the aisle, not communicating effectively. Think about it. You're somewhere in Idaho, and someone tells you about federal workers who are laid off. Well, right, that's what I asked for. I asked Trump to drain the swamp. We know we're not the swamp, but what have we done to communicate that to anybody? We're talking about infrastructures and workers instead of what those workers do for us. Instead of saying that these are the people who keep your kids from getting meningitis. These are the people who help to make sure that you are safe. We right now, this is an important moment in public health. The philosopher Tyler Durden said that once you lose everything, you're free to do anything. That's Fight Club. He's not a philosopher. Some of y'all are going to go Google that. So, but it's true nonetheless. We have lost. this is a very difficult public health week. We are down 20 points with a minute left on the clock. No matter what we do, we're going to lose this game. The problem is if we let this loss dictate the rest of the season. It's not over. It's time to re-engage. It's time to talk to people, not to judge, to be empathetic listeners, to talk to people. We have to get better at knowing what to say. When people say to us, remember, we used to say things like, take the vaccine because it's good and it'll save your life. And now someone gets up in the crowd and says, well, I'm disappointed about that one child who died of measles, but what about the thousands who died from the MMR? And what do we say? We want to say, like, shut up. That's dumb. We're scientists. We can't say that anymore. We have to know how to pivot. We have to be much more like politicians than scientists. But politicians who have trust, politicians who have evidence, politicians who have facts. Listen, if you don't want to follow the evidence, that's your choice. Make bad policy. God knows it wouldn't be the first time in this country's history that we've made bad policy. But don't deny facts. Don't deny truth. Just be honest. I heard your facts, I heard your science, and I'm doing something totally different. That would be refreshing. But don't destroy what we have. And I heard my good friend George's Benjamin talk about, physicians in the last panel. Do you gotta have physicians online telling us about what's healthy? Are we talking about physicians like Jay Bhattacharya or Marty McCary? We're in this weird spot, guys, where we now have physician-on-physician crime, right? My Yale-trained physician said ivermectin isn't healthy, but your Harvard-trained physician said it is. Remember, Nancy Mace, representative from South Carolina, just tore up a woman from Twitter, said, how dare you silence these brilliant physicians trained from Stanford and trained by Harvard and trained by Yale. How dare you silence them? Well, I silenced them because they were spreading crap. And just because you are graduated from Stanford doesn't mean you're right. I graduated from good old North Carolina State University, and I know more than Jay Bhattacharya. But this is the problem in the world that we're living in. This is what this Public Health Week is about. This Public Health Week is about reconnecting to what we are, reconnecting to our science, separating our science from our policy, allow the policymakers to use our evidence, but we have to learn how to talk to everyone, and we have to learn it fast, because the next game's gonna be up, and we need to be ready.
People who are about to go for a round of applause. That was fantastic, Brian. I'm so excited to be here with our two panelists. My name is Vina Thomo-Salvin. I'm a recent MSPH grad, just like Deanna mentioned, and I have not been around on this earth as long as National Public Health Week. And so I have to honor the two giants who are sitting next to me because they have accomplished so much. And when I think about this panel here today and reflecting on the past 30 and thinking ahead, I mentioned earlier I work with high school students. My favorite, I have 2 part-time jobs, or 2.5 if you want to be particular. And the one I really love is I work with high school students, teaching them empathetic communication techniques about how to combat misinformation in their own communities. Because we have decades of research that show, as our panelists have also talked about, that the best influencers, the folks who you should be getting trusted information from, the people who you look to, are the folks in your community who you've known, right? And by teaching these high school students, I'm hoping that they become the next generation of trusted community leaders. And I think about that for myself as an early career professional. It's been about almost a year since I've graduated. I think about all my peers who are about to graduate in May, inheriting a very tumultuous public health field, right? And also trying to get a job. Me too, guys. Let me know if there's any job openings. I'm trying. So I really want to hear from our two stalwarts today. You already kind of touched on this, but let's look at the past and then think about how we can take lessons from the past into the future. And the first thing is, you kind of mentioned in your intros, but I'd love to hear what was one very transformative public health win from the past 30 years that you think we should be thinking about in helping us navigate the present?
Well, I mean, I think I think that I put two on the table, and there are many situations where and I think it's a big challenge actually in public health, where respect for individual self-determination, individual preferences and choices become extremely important. I also think we have to learn in public health how to, going back to the first panel, how to communicate when, in fact, coming together as a group is the better idea. I remember during the debate over the Affordable Care Act, being on a Senate panel in which one of the senators at the hearing kept pressing panel members about why his insurance should cover maternity care. This was when we were debating, among other things, what should be part of what is known today as the Essential Health Benefits Package. And of course, maternity care is considered to be an essential health benefit that all Americans are insured for. And it was just this sort of stunning moment when the issue was not, did his individual family have a need for maternity care? Obviously, he did not have a need for maternity care, but that he really was troubled by the notion that everybody in society had a reason to care about healthy pregnancies and birth, which, of course, are influenced by maternity care. And so we have to be able, I think, to convince people that for all of the value that Americans very properly place on individualism, there are very important places where we just simply have to come together as a society. And I think that's where we have fallen down heavily. Going to Brian's point about, how to climb out of the hole we're in. How do we show people those moments? Interestingly, the Medicaid battle that's going on today, I think, is an exemplar. We are living through if you had told me 50 years ago when I started as a legal services lawyer that Medicaid would be the hill that everybody would be dying on at the moment as a case of one of the cases of solidarity, I would have laughed. It was a program for a couple of million people when I began. And for all kinds of reasons, it's become a program for 80 million people. And suddenly it is very clear why we have a collective interest in not letting the program fail. Which is not to say that there are not a million things you wouldn't do to improve Medicaid, but we're looking at system failure right now. And so I think that these moments, as terrible as they are, also give us a chance to revisit the question of when societies simply must come together.
Yeah, you mentioned individualism. I mean, individualism is a wonderful thing until it goes toxic, right? Too much of any one thing is going to sooner or later hurt your health. And I will, though, when I think of individualists, like people who are entrepreneurial, I think of like Jeff Bezos, right? The guy that founded Amazon. I mean, think of what he did. I mean, he did it all by himself. He built his own roads to drive his trucks that he built, to the airports that he built, to fly on the planes that he built. It's an amazing story of being individual. Those were our roads. Those are our planes. Those are our airports that we built. And yet he's not paying the taxes that he should be for being able to use those things. There is, it's like a turtle on a fence post. It didn't get there by itself. And that's every American. That's every American business. That's every person in our country. But we still hold on to this idea of individualism. And at this point, it has just gone toxic to say that I will not take a vaccine because you're protecting your life is not as important as my concept of freedom is not a country. And my favorite thing during the pandemic were religious leaders saying, you do you on the vaccination. And I think that's a great thing. I think it's Peter 5:17, where Jesus said, hey, you do you. Don't worry about the poor. Don't worry about the sick. You do you. It is the most antithetical statement to any religion there is. Every religion we have is about caring for other people. It is a tenet of every religion that is practiced. And yet, during the pandemic, we sat there and had these ideas, and no one stood up and said, that's crazy. We didn't have the relationships that we needed to have people come to our aid. We went in front of city councils when our jobs were on the line and said, well, I'm here with all my friends. We looked behind us and there was no one there. It was really easy to terminate public health leaders during that time. But we have had achievements. The elimination of smoking, right? We're at the lowest rates of smoking in decades, not because of our individual cessation campaigns, honestly, not because of our billboards, because we tax the living hell out of it, right? Policy is the prescription for better health, and yet every conversation about health at a legislative level becomes a conversation about pills and procedures when we need a conversation about policy. And the other thing I think we forget sometimes, now I'm 50. I know I look hella good, but I'm 50. I have a 13-year-old and a 15-year-old. You can say condom, you can say dental dam, you can say whatever to them, and they're like, yeah, whatever. Right? That's the least of it, Dad. I remember I was 8 years old when the HIV epidemic started in the U.S. And you didn't talk about condoms. Dear God, that day that the teacher brought the banana out and it was like the most scandalous thing ever, like now it's nothing. Like we did that. Public health did that. How many lives did we save? Because we went to the bars and we did the outreach and we talked to people. Right? We did that. We normalized condom use in a way that wouldn't have been done without us. And that's important. Now, my concern is that if that same epidemic started today, we would be fighting about whether HIV causes AIDS. We'd think it's probably a scam of big pharma. You know, it was probably brought on by the condom companies to make revenue. And this is our problem, right? We are living in a time where we get to experience the dark side of egalitarian media. In some ways, it's an amazing time to be alive because you can put something on Medium that goes viral, that changes people's minds, that changes our political structure. We can do that just with a click. But that same click is just as dangerous in the other direction, right? There's always been snake oil salesmen. They just couldn't reach 1 million people with a click of the mouse. Now they can. So again, we have had amazing achievements. The sad part is they're all in the middle of the table. They're all in jeopardy now. And so the question that we all have to grapple with, because I see on LinkedIn, it's like, oh, this is a dark and sad public health week. It is not dark and sad. We have to get up off the mat. I know it's hard. I know people have lost their jobs. My wife lost her job. I am right with y'all. But you either get to living or you get to dying. And this is the moment, this week, for all of us has to be, how are we going to do it differently? How are we going to get to living? We all talk about DEI, right? And that inclusivity, right? Raise your hand if you've had a conversation with a conservative MAGA Republican lately. A couple of us. Are we being inclusive if we're not reaching out to that sector? Yes, but they don't like us. That's a lot of people don't like me. I still talk to them. Julia's here. Half the staff sometimes, Julia, don't like me, and I still have them over to the house for sauce, right? So we have to find a way to move forward knowing that we've kind of gotten our teeth kicked in a little bit. But you got to ask yourself how after all of these things that we've done, after all of the things that we have delivered to this society, can we so quickly be cast aside? That's the research question that we have to answer going forward. And don't talk about how young you are. I'm going to go get a hip replacement just because, proactively now. Georges, maybe you and I can get a 2-for-1 somewhere.
For one special. I actually really appreciate both of you because you touched on something which I think is really important to many of us. I'm talking about grads, I'm totally taking charge of this conversation because for our folks who are graduating, both of you talked about policy wins. And, Sarah, I go back to you because you were instrumental in the first, expansion of Medicaid, you testifying in Congress at the federal level. And so talking about, coming full circle, what strategy did you use then to help when you were talking about such a critical piece of policy? And what strategies should we, as incoming grads, as current professionals, be using to ensure that we get those policies through that are going to protect our communities?
Well, that is a good question. I have to say, and I look at the dean or Dr. Benjamin, who I think we're all sort of the same vintage here. You know, I was unbelievably fortunate in that I began to do serious sort of system change work, systemic reform, at a time when, and it was not, I mean, the greatest expansions came during the Reagan era, the incremental expansions that sort of set the stage for everything else. But I always tell my students that the Emergency Treatment and Labor Act, possibly the most important civil rights, healthcare right we've got in the United States, was passed in a Republican Senate, a Democratic House, and signed by President Reagan. And the two bills were the same. The quarrels were over very little. So I tell you this because the playing field was very different. We had not sort of begun this terrible atomization as a society. And, you know, it's very interesting. I'm completely not connected to social media. I don't do anything. I have no social media presence. And I have always preferred it that way, which may be good and may not be good. But I think now we're beginning to grapple with how much social media has altered the ability to come together, because it has atomized, it has allowed everybody to atomize themselves. And I was so lifted by the first panel talking about what we have to do to sort of regain community trust, right? But it is very difficult for me to convey to my former students or to colleagues or whoever how different the world was. It was different for the creation of environmental laws. It was different. I mean, when did the EPA become a law? It became a law under Richard Nixon. The things that you just can't even begin to get your mind around today. And much has been written about the atomization of society and the inability. That's why I consider, in my case, the examples I gave, two of the great examples of coming together as a society. And we came together in public policy. And the question is, can we get ourselves back to a time when we can come together in public policy, A, because it's really good for society, but B, so that you will all know the pleasure, just the sheer pleasure of having a moment of social solidarity. And, you know, I know that this panel is also supposed to talk about the next 30 years, and it's very depressing to somebody like me, or I'm sure the dean or Dr. Benjamin, that we're now in a crouch mode, just defending what we have, when everybody knows that what we have needs huge work. So I think the first act, actually, to come together is to come together in defense. I think that is where those of you who are younger and just starting a policy career, will unfortunately have to begin your work. But let me tell you, there's nothing wrong with defense. It is absolutely, in its own way, as exhilarating as forward motion. So what you want to do is be active, whether it's an APHA, whether it is the Human Rights Campaign. It doesn't matter what it is, but to bring your skill set to bear on defense may be the most important thing you all can do to start a career that hopefully then will get you into forward motion.
Appreciate it, Sarah. Thank you. And Bren, I want to tweak that question for you because Sarah's speaking from, a federal perspective. But Brian, you have tons of experience working in local public health offices. I understand it's 3 states, Georgia, Texas, and PA, or Philadelphia, that you've been. And so I want to hear from your perspective, when we talk about policy coming together and at the local level, what do you think from your experience, what can we take from that into the next 30 years?
I mean, I'd like to think we're closer than we think. I have never walked into a legislator's office and said, hey, let's kill some old people, and have them be like, yeah, let's get some old people and just like off them. Like, they'd be like, you're horrible. You're an awful human being. We want to help our elderly. We want to make sure they can grow old in place. This is really important. It's like, oh, okay, I actually think elderly are important too. We should talk about this and work together. Awesome, great, check. But you walk in and you go, hey, let's talk about public health. No, right? It's the wrapper. It's not the candy, right? Could you imagine like some really great candy in a really bad wrapper? Right? Or even like, what do I look forward to it's April, what's Easter, the 21st? And I just wait every year for that damn bunny that clucks. Because what does that signal? Come on, y'all know. Cadbury eggs. Like, you're right, because you were like my age when that first came out. And you're like, oh my God, it's a chocolate egg with something inside, which I don't know and I don't think about. I just eat the egg. Like, how are we having that conversation? I mean, we've gone ahead in our city health program, cityhealth.org, and passed policies throughout the country at the local level just by giving mayors a medal and explaining to them why it's important for them to advance policy. And they're like, wait, you gave the next town over a medal? They got a gold medal? I don't have a medal? What do I need to do? Now, do I need them to be, crusaders for public health? No. I just need them to do the work to improve the health of the population. And that's what we have to think about. So I want to twist, defend a little bit, because I defend in a game where I'm against you. I need to facilitate an understanding moving forward. And it's not going to be overnight. We're going to have to defend like now, because the house is on fire, you got to put the house out. I totally agree with that. But we quickly have to pivot to understand what is it that got us into this spot, right? Why did people start believing that measles could be cured by vitamin A? How did that happen? Where did it grow? Is it all because of Jenny McCarthy? Like, why was it? And what happened? Like, I love these MAHA moms. Why aren't there public health moms? How did this, lunatic of an HHS secretary decide that these moms were for him? I mean, they are passionate. We don't have that passion. We're passionate about public health, but we're not passionate about getting people to be passionate about public health, because we've never talked about it in a way that is engaging, right? We've never talked about it in a way that lets people understand the value that we're bringing, that they're able to go to work and to school because public health allowed that to happen. We blazed the path for them to have the life that they want. But we never really got to what we are. We're a health department. I'm an epidemiologist. And we're against it because the hard part here is, at what age do you really begin to understand that your individual health is indelible from your community health? College, maybe? That's not what they're teaching in elementary school, right? They're teaching you, to wash your private bits and go to the doctor. That's what health class is. And then we even have, I think the greatest enemy against public health is Doc McStuffins. I know, you might not think of Doc McStuffins. Like, even George is like, I ain't heard this rant, so this is what I'm looking forward to. And my kids were growing up and we watched Doc McStuffins all the time. Right? And Doc McStuffins puts on her white coat and there's a little doo-doo-doo-doo, and she can solve every problem. Every problem is solved by the white coat. We individualize from infancy, and we acculturate people to medicine. No one played epidemiologist as a kid. I took my daughter's dolls because my father-in-law is a physician. He's the only person I make me call Dr. Castrucci. Because when I met my wife's mother. She said, go call me Nancy. And I met my future father-in-law. He goes, call me Dr. Rosfredo. I was like, okay, I see how this is playing out. And so he gave my kids that Melissa and Doug dress-up doctor kit. right, with the stethoscope and the white coat. Well, I took the stethoscope, I put a notepad in, and we did outbreak investigations amongst her dolls. So what Chloe will tell you, if one of her friends says to her, what's the difference between your dad? Because isn't your dad a doctor? And she's like, kinda. And what's the difference between like my pediatrician and your dad? And Chloe will, without missing a beat, will say, the pediatrician helps one person at a time. My dad helps everybody all the time. That's the movement we need. We only need so many Chloes on the planet because she's very snarky. But that idea of that's what we do. We're helping everyone all the time. It goes back to the CDC 24/7. We've lost that. We've become, there's the 24/7 side, but then there's also the most horrific kind of public health image of Mike Bloomberg dressed up as a nanny on the front cover of the New York Post when he was trying to deal with the soda size issues. We have to be smarter. We have to be smarter. How many people do you think wore a mask because of the mandates? But how much political capital did we lose pushing the mask mandates? I'm not saying one is right or the other is wrong. I'm asking us to think. I'm asking us to be better. I'm asking us to be more political in our future. And that's how we're going to make it work at a local level. That's how we're going to get policies passed. Because honestly, everyone wants to be healthy. So we agree on the goal. That's a plus. We disagree right now on the tactics. That's what we have to work on. But don't lose sight that no one wants to, I don't care if you're a Republican, a Democrat, an independent, a communist, a Proud Boy, I don't care what you are, you don't want to bury your kids. Like, raise your hand if you want to bury your kids. So we can arrest you because you're a psychopath. You want to see your kids have grandkids. You want to see that. You want to live a healthy life. There's no one who doesn't want to do that. We got to work on that commonality, that one thing that we have in common, and build on it.
Thank you both. I really appreciate that. I want to give now this moment to open up to the audience for any questions. I got a long list, but I don't want to monopolize the discussion either. Oh, over here. Mm-hmm.
Good afternoon. Oh, that's too close. My name is Rochelle Andrade, and I work for the National Hispanic Health Foundation. My question is, with the rise of AI, how do you see AI helping or potentially contributing to the misinformation in media about public health?
AI is a tool. I could take a hammer, and I could build a village with that hammer. I could also bash your skull in. It's a tool. AI is a tool. What we have to do is get ahead of how we use that tool. So we are working with, and I will have a decision on this in a couple weeks, we are working with a company to help us build and train a communications AI bot, if you will, brain, whatever they call it, to help us be able to tailor messaging so quickly, right? So that, because what we get at the Public Health Communications Collaborative, which if you don't know about PHCC, go to publichealthcollaborative.org. Everyone calls oh, Brian, I'm going to see a Republican city council in 30 minutes, and I need to talk about tobacco. What do I say? Well, if you had 6 months and $400,000, I could totally give you the right messaging. But you have 30 minutes. We need to use all of the information that we have to train up an AI to help us say, this is what you're going to say, right? I have had the great pleasure of working with Frank Luntz, who is a Republican pollster. He is a genius when it comes to messaging. We need to take his brain and make it into AI, because he can just, and listen, it's not always science when he's doing messaging, but every message that man comes out with tests on point, because he just knows how to do it. So how do I talk to, if I'm in a community of Hispanic women over 40, right? How do I talk to men over 70 in Maine about safe sex? Right? I'm probably not going to start out with a Kendrick Lamar tune, maybe more of a Frank Sinatra. But help me get there. We have the research. The tragedy is we reproduce research more than we use it and translate it. So one group is about to do how to talk to people about health equity without using the words health equity, and that's a great thing, and they publish it, and then someone else does the exact same thing. let's synthesize our research. Let's coalesce our research. And let's use AI to do that so that we can take our research and make it the most impactful that it can be and help us with our messaging. So when someone says, hey, AI, when someone says, I am all for fair housing and I want people housed, but they got to be drug tested, right? That's fair, isn't it? What's my pivot? What do I say to that? I can't sit there dumbfounded. I need a pivot, right? I need to be like, bam. We need to write like Aaron Sorkin. We need to be like the Aaron Sorkin public health people who are just quick and type and staccato in our responses. But we would just sit there and you see politicians. I don't know. Well, I disagree with you that they should be drug tested. Why do you disagree with me? Aren't drugs bad? Well, yeah, I mean, drugs are bad, but what? I need tight messaging. I need to be ready to go into a room. I need to have all the things. It's like Batman. Remember Batman? Batman had a utility belt. And he would oh, I need this now. I need the grappling hook. Our utility belt is far too sparse. And I think AI can help us build that belt.
Fine. We have time for one more question from the audience. All right. If there is time for one more question, Michelle. Oh, Susan. Woohoo.
Hi, I'm Susan Poland. I'm actually with APHA. And I have a question, Brian, this is for you. Because I completely agree that we need to talk to the other side. But how do we do that when the door is locked against us? Messages don't work, pressure doesn't work. How do we break down to really have that conversation?
So who locked the door?
They did.
No, they didn't.
Yes, they did.
No, they didn't. I disagree with you, Susan. And this is George's oh hell. This is like a good UFC fight. Yeah, we should promote this. Yeah, I don't think they locked the door. I think we had a whole, way that we locked that door. And so we're doing some work with NACO. I just brought a précis through to my board, and one of my board members said, this is a great précis. It would have been better 30 years ago. So I think we're paying a price for years of misguided messaging, maybe arrogance, maybe being a little too hoity, maybe not communicating with people effectively, maybe writing people off. Come on, guys. You got to remember that at the start of the pandemic, if you weren't getting a vaccine, what did we say to people? What did we say to Republicans? If you don't take a vaccine, you're a Republican, then you get COVID, it's on you, you die. We said it. We said it. And we have to own that. So I do think the door is locked right now, but I think we have to start just because the door is locked, we got to keep kicking it down. There's a Republican somewhere at a state or local level. Now listen, here's the big fun. I am a registered Republican. I am not a MAGA Republican. And John Kasich, who I get to work with a lot, and Frank Lentz, who I've worked with, we're all rhinos now. So it's not necessarily finding the MAGA person, but it's finding the Republicans at a state and local level. Because listen, at the end of the day, Marjorie Taylor Greene has no job. Okay, what do they actually do? You don't have to pass a bill. You don't even have to show up half the time, and they'll still vote you in. So she can run around and yell about stuff all day. You know who can't afford that? Mayors. Mayors have to get stuff done. City council has to get stuff done. County commissioners need to get stuff done. And so we have to go back to the local level and find our allies there. Because any minute, we keep going back to Bill Frist, and someone's going to hug him too hard, and he's going to turn to dust any minute. And more importantly, Bill Frist couldn't win a Republican primary in the state of Tennessee today on his best day. So we have to find our allies, and it's going to take more work, and it's going to be harder, and we're going to have to build trust. But you know what? You build trust by showing up. You build trust by doing what you say you're going to do. You build trust by doing it again and again. And we're going to get there. It took us a long time to dig this hole. It's going to take us an equally long time to climb out of it. But if we retrench, right, when we say this is not math, okay? The day after the election, I'm hearing public health people say, well, the country got it wrong. No, the country made a choice. It's not math. If we continue to think that we're right and they're wrong and speak in absolutes, we will fail. You cannot correct their math. 2 + 2 is not 9. I will correct that. But the choice that they made, we have to reckon, how did this person get elected? What did we do wrong? How did we not get our message out clear enough? And we need to start building that back. Patrick Guerra, who runs Civitas, brilliant man, right? Get our book. George and I have a book, Public Health Under Siege. Go buy that book and read his chapter on gay marriage, because he is old enough to remember waking up and Ronald Reagan was the president. And then many years later, we're like, yeah, love is love. He's like, yeah, love was not love in the Reagan administration. But we didn't just fold up shop. We started to fight, and we started to talk, and we started to build back. And then all of a sudden, remember, like we woke up one day and it was like, oh yeah, love is love. It wasn't that simple. We now have to start doing that same thing in public health. But do not say to this other side about how they were wrong, or be reductionist to say Trump won because we're a racist country. That may be true, but that's awful reductionistic is why he won. And what did we do during COVID that seeded this garden? We seeded the garden where misinformation grew. So we have to be very clear about how we never do that again. Tony Fauci did say, we will never have to wear a mask. And then guess what? We did. So you can excuse it. You can lie for the right reason. It's still a lie. So I want us to think about, see, we got the faces. That's the point. I want us to think about this. I want us to hold it and say, what did we do right? What did we do wrong? And then maybe we can knock down that door. Because I don't care if you're a Republican. I don't care if you're a Democrat. I care if you're healthy. And that's what we have to lead with moving forward. That should be the theme of the Public Health Week. You got to be healthy, because it's the key to everything you want to do, right? You want to go to church, you got to be healthy. You want to graduate high school, you got to be healthy. You want to go to work on time, you got to be healthy, right? That's the thing. And to make sure that health is something that's equal among people. I almost died 2 years ago with congestive heart failure. I was better within 3 months. Do you know why I was better? Privilege. Absolute privilege. Everyone should have that. Health should not be a luxury item, but it sure as hell is right now in America.
Thank you, Brian. A round of applause for our panelists. While Deanna is walking up, I want to remind folks a small right thing you can do today is actually responding to an APHA action alert. It makes writing to your legislator super simple. All you have to do in Google is type in APHA action alerts, and the page pops up. There's a new one to talk about the 2026 appropriations bill and protecting public health funding. So do it right now. Like, it's literally super duper fast. You put in your zip code and they got you. So please do that as one small way for us to do good during Public Health Week. But I'll pass it off to Deanna.
Thank you, Vina. All right, so we are drawing to a close, but I have to say a couple of things. First of all, Brian, from now on, it's either pastor or coach. I'm trying to decide which one to call you, because I was over there with some amens, and then also like, yeah, let's go get them. So yes, thank you for that. I also wanted to say, in respect to what Vina was speaking about, to our students, I want to thank you for being here, to our recent grads, to our alums, to our folks who are in the midst of this dismantling of our infrastructure. We see you, and we are standing loud and proud and strong with you. We need to remain a united force while we figure out what the messaging looks like, right? We need to remain a united force. And so I just want to always bring it back to the beginning. All of my students know that I do this, right? But what we do, right, is the fulfillment of society's interest, right? And ensuring that all populations are healthy within this country. And so that's what we do. That's the answer to that. You know, you don't go into the politician's office saying, oh yeah, I'm in public health. I'm here to make sure that your constituents are healthy. That's why I'm here. Okay, sorry for the off script a little bit. But I wanted to just say, as the forum draws to a close, I really want to extend my deepest gratitude to all of the speakers, all of my colleagues, all of the professors and students and instructors and staff who are here. Thank you so much, Dean Goldman, for hosting us. And thanks to all of you who are online. I know it's quite a few, and we appreciate that you're there watching us. All of you, collectively, all of us, our engagement and our commitment are the driving forces behind the continued advancement of public health. And so I'd like to thank you for being a part of this milestone event. Let's continue working together. We're going to leverage our collective knowledge, passion, and commitment, Brian, Pastor Brian for that, to protect and promote the health of all people. And I just want to say this as an old Star Trek fan. We are in unknown territory, right? We are in unfamiliar territory. And so what we need to do is just boldly go. We've got this. We need to get our messages together and step forward and keep fighting. Let's go. Thank you. We're going to have a reception. Yes, we're going to have a reception across the hall. She thought I forgot, but I didn't. We're going to have a reception across the hall. The APHA staff members at the back of the room will be happy to assist you as we show you how to get there. And thank you all again. Have a wonderful afternoon. Thank you online. When I see y'all in your different states and affiliates, just come up and give me a hug. Bye.